Hello friends and welcome to my channel. In this video we'll be learning about the anatomy of the uterus. To begin with, this is a right lateral view of the uterus. This is the anterior aspect and this is the posterior aspect. The uterus is a childbearing organ in females situated in the pelvis between the bladder in front and the rectum behind, as you can see right here. Though it is hollow, it is thick-walled and firm. It protects and provides nutrition to a fertilized ovum, enabling it to grow into a fully formed fetus. Now let's look at the size and shape of the uterus. This is the anterior view of the uterus. It is piriform in shape, that is, it is pear-shaped. It is about 7.5 centimeters long, 5 centimeters broad and 2.5 centimeters thick. It weighs 30 to 40 grams and the uterus is divisible into an upper expanded part called the body, as you can see right here, and a lower part that is cylindrical and which is called the cervix. Now the junction of these two parts, that is the body and the cervix, is marked by a circular constriction which is called the isthmus, and the opening through it is called the internal os. The part of the uterus that lies above the opening of the fallopian tubes that you see right here is called the fundus. This is the fundus. The body forms the upper 2/3 of the organ and the cervix forms the lower 1/3 of the organ. Now the superolateral angle, that is superiorly and laterally, that is away from the midline, approximately right here, the superolateral angle of the body project outwards at the junction of the body and the fundus and is called the cornua of the uterus. The uterine tube, that is the fallopian tubes, the ligament of the ovary and the round ligament are attached to this cornua of the uterus on each side. Now concising the important points under the introduction to the uterus is a childbearing organ in females situated in the pelvis between the bladder and the rectum. Though hollow, it is thick-walled and firm. It protects and provides nutrition to a fertilized ovum, enabling it to grow into a fully formed fetus. Looking at the size and shape, the uterus is piriform in shape. It is about 7.5 centimeters long, 5 centimeter broad and 2.5 centimeters thick. It weighs about 30 to 40 grams. It is divisible into upper expanded part called the body and lower cylindrical part called the cervix. The junction of these two parts is marked by a circular constriction called the isthmus. The part of the uterus above the opening of the fallopian tube is called the fundus. The body forms the upper 2/3 of the organ while the cervix forms the lower 1/3. The superolateral angle of the body projects outward at the junction of the body and the fundus and is called the cornua of the uterus. The uterine tube, ligament of ovary and round ligament are attached to it on each side. Now let's learn about the normal position and angulation of the uterus. This is the left lateral view of the uterus. This is the anterior aspect. This is the posterior aspect. Here is the uterus and this is the vagina. So normally the long axis of the uterus forms an angle of about 90 degrees with the long axis of the vagina, as you can see right here. This angle is open forwards. Now the forward tilting of the uterus relative to the vagina is called anteversion. And the backward tilting of the uterus in relation to the vagina is called retroversion. Now one more thing you can notice here is that the uterus is slightly flexed at the level of the internal os of the cervix, and this is called anteflexion, which is 125 degrees right here. We had seen earlier where is the internal os. So here is the internal os in this diagram. So the uterus is slightly flexed at this level of the internal os of the cervix and it is called angle of anteflexion, which is 125 degrees. To look at it more clearly right here, you can see that the long axis of the uterus makes an angle with the long axis of the vagina, which is 90 degree, which is the angle of anteversion. And in this diagram, you can see that the long axis of the uterus makes an angle with the long axis of the cervix at the level of the internal os, which is 125 degree, that is angle of anteflexion. Here you can see the normal position of the uterus. It is anteverted with an angle of 90 degree between the uterus and the vagina. Here you can see a retroverted uterus shown in green. It is tilted backwards. Now let's look at the communications of the uterus. Superiorly, on each side it communicates with the fallopian tube, that is the uterine tube, and inferiorly it communicates with the vagina. Now let's look at the parts of the uterus. The uterus comprises of the fundus that you see right here, the body with two surfaces, that is the anterior or vesical surface and posterior or intestinal surface, two lateral borders, and a cervix. Now before we look into detail about the parts of the uterus, let's concise the important points that we learned till now. Under the normal position and angulation of the uterus, normally the long axis of the uterus forms an angle of about 90 degrees with the long axis of the vagina. The angle is open forwards. The forward tilting of the uterus relative to the vagina is called anteversion. The backward tilting of the uterus relative to the vagina is called retroversion. The uterus is slightly flexed at the level of the internal os of the cervix, which is called anteflexion, which has a degree of 125 degrees. Looking at the communication, superiorly on each side it communicates with the uterine tube. Inferiorly, the uterus communicates with the vagina. Looking at the parts, the uterus comprises of a fundus, body with two surfaces, that is anterior or vesical and posterior or intestinal, the two lateral borders, and a cervix. Now let's look at each of the parts of the uterus in detail. First, let's look at the fundus. The fundus is formed by the free upper end of the uterus. It lies above the openings of the uterine tubes, right here. It is convex like a dome, and it is covered with peritoneum and directed forwards when the bladder is empty. The fertilized oocyte is usually implanted in the posterior wall of the fundus. Now after the fundus comes the body of the uterus. Let's learn about it through this diagram. This is the lateral view that I had shown you earlier, and here is the fundus. Here is the body of the uterus. It has an anterior or vesical surface and a posterior or intestinal surface. We're looking at the anterior surface, that is the vesical surface of the body of the uterus. It is flat and related to the urinary bladder in front. It is covered with peritoneum and it forms the posterior or the superior wall of the utero-vesical pouch. The pouch that you see here is the utero-vesical pouch. So, the anterior surface of the uterus forms the posterior or the superior wall of the vesico-uterine pouch. Now, looking at the posterior or the intestinal surface of the uterus, it is convex and it is related to the coils of the terminal ileum and to the sigmoid column. Now this is also covered with peritoneum and it forms the anterior wall of the retrouterine pouch. This is the retrouterine pouch that you see right here, and the posterior surface forms the anterior wall of the retrouterine pouch. Now let's learn about the lateral borders of the uterus through this diagram. Each lateral border right here and right here is rounded and convex. It provides attachment to the broad ligament of the uterus which connects it to the lateral pelvic wall. Now, this broad ligament is present on the other side as well. The uterine tube, that is the fallopian tubes, open into the uterus at the upper end of this border, right here and here. Now this end of the border gives attachment to the round ligament of the uterus, as you can see right here. Now in the coronal section of the uterus, that is the frontal section, to let you know what is coronal section or frontal section, it divides the body into anterior or posterior parts, or the ventral and dorsal parts. So here in the coronal section of the uterus, the cavity is triangular in shape, as you can see right here. And the apex is directed downwards. And at the apex, the cavity becomes continuous with the canal of the cervix, and this junction is called the internal os. Now let's look at the cervix of the uterus. The cervix is the lower cylindrical part of the uterus. It is about 2.5 centimeters long and is slightly wider in the middle than at either end, as you can see right here. Now the lower part of the cervix projects into the anterior wall of the vagina, which divides into the supravaginal part and the vaginal part. We'll be looking at it in detail. Now let's look into the details of the supravaginal and vaginal part of the cervix in this diagram. The supravaginal part of the cervix is related anteriorly to the urinary bladder, as you can see right here. Posteriorly, it is related to the retrouterine pouch, and on each side it is related to the ureter and to the uterine artery. Now looking at the vaginal part of the cervix right here, it projects into the anterior wall of the vagina. The spaces between it and the vaginal wall are called the vaginal fornices. As you can see right here, this is the posterior fornix, this is the anterior fornix. Now the cervical canal opens into the vagina by an opening called the external os that you see right here. In nulliparous women, the external os is small and circular, while in multiparous women, the external os is bounded by anterior and posterior lips. Now, what is nulliparous woman? It is a medical word used to describe a woman who hasn't given birth to a child, whereas a multiparous woman has given birth more than once. Now, as you can see in this diagram, this is the external os in a nulliparous woman. It is small and circular, while in multiparous women, it is seen as transverse and it has anterior and posterior lip, both of which are in contact with the posterior wall of the vagina. Now in this diagram, you can see that the cervical canal is fusiform in shape. It is flattened from before backwards so that it comes to have an anterior and posterior wall. These walls show mucosal folds which resemble the branch of a tree called arbor vitae uteri, and the folds interlock and close the canal. You can look at it more clearly in this diagram where you can see the arbor vitae uteri, that are the mucosal folds which resemble the branch of a tree, and these folds interlock and close the canal. Now concising the important points that we learned under the parts of the uterus, firstly let's look at the fundus. It is formed by the free upper end of the uterus. It lies above the openings of the uterine tubes. It is convex like a dome. It is covered with peritoneum and is directed forwards when the bladder is empty. The fertilized oocyte is usually implanted in the posterior wall of the fundus. The anterior or vesical surface of the body is flat and related to the urinary bladder. It is covered with peritoneum and forms the posterior or superior wall of the uterovesical pouch. The posterior or intestinal surface is covered and is related to the coils of the terminal ileum and to the sigmoid column. It is covered with peritoneum and forms the anterior wall of the retrouterine pouch. Now each lateral border is rounded and convex. It provides attachment to the broad ligament of the uterus, which connects it to the lateral pelvic wall. The uterine tube or the fallopian tube opens into the uterus at the upper end of this border. This end of the border gives attachment to the round ligament of uterus as well. In the coronal section or the frontal section, the cavity is seen to be triangular in shape, the apex being directed downwards. And at the apex, the cavity becomes continuous with the canal of the cervix, and this junction is called the internal os. Looking at the important points, under the cervix of the uterus, the cervix is the lower cylindrical part of the uterus. It is about 2.5 centimeters long and is slightly wider in the middle than at either end. The lower part of the cervix projects into the anterior wall of the vagina, which divides into supravaginal part and vaginal part. The supravaginal part of the cervix is related anteriorly to the bladder, posteriorly to the retrouterine pouch, on each side to the ureter and to the uterine artery. The vaginal part of the cervix projects into the anterior wall of the vagina. The spaces between it and the vaginal wall are called the vaginal fornices. The cervical canal opens into the vagina by an opening called the external os. In nulliparous women, external os is small and circular. In multiparous women, external os is bounded by anterior and posterior lips, both of which are in contact with the posterior wall of the vagina. The cervical canal is fusiform in shape. It is flattened from before backwards so that it comes to have anterior and posterior walls. These walls show mucosal folds which resemble the branch of a tree called arbor vitae uteri. The folds interlock and close the canal. Now, after having learnt about the parts of the uterus, let's look at the ligaments of the uterus. We have peritoneal ligaments and fibromuscular ligaments. Firstly, looking at the peritoneal ligaments, they are peritoneal folds which do not provide any support to the uterus. We have anterior ligament and posterior ligament that cannot be seen in this diagram. The anterior ligament consists of utrovesical fold of peritoneum, whereas posterior ligament consists of rectovaginal fold. Now, let's look at the right and left broad ligaments, as you can see right here. The right and left broad ligaments are folds of peritoneum which attach the uterus to the lateral pelvic wall. Now, when the urinary bladder is full, the ligament, that is the broad ligament, has anterior and posterior surfaces, upper and lower, medial and lateral borders. The upper border is free. Now, the ovary that you see right here and here is attached to the posterior layer of the broad ligament through the mesovarium, as you can see right here. Now, the part of the broad ligament that lies between the uterine tube, that is the fallopian tube on both the sides, and between the ligament of the ovary is called the mesosalpinx, that is the area right here. The area between the uterine tube and the ligament of the ovary is called the mesosalpinx. Now, the part below the ligament of the ovary is called the mesometrium. Now, we learned about the area that is the mesosalpinx and the mesometrium. Now, the part of the broad ligament that stretches from the upper pole of the ovary and the infundibulum of the uterine tube to the lateral pelvic wall is called the suspensory ligament of the ovary or the infundibulopelvic ligament that you see right here and right here. Now, what are the structures that the broad ligament contains? The broad ligament contains the uterine tube that you see right here and here. Second, it contains the round ligament that I had shown you earlier, round ligament of uterus. Third is the ligament of ovary, that is ovarian ligament that you see right here. It is present on the either side as well. Fourth, you have the uterine vessels, the ovarian vessels, the uterovaginal and ovarian nerve plexuses. So we have learned about the vessels, the nerves. Then the epophoron and the paraphoron. Now, what is epophoron and paraphoron? Epophoron is the homologue to epididymis in males and paraphoron is the homologue to the paradidymis in males. Then comes the lymph nodes and lymph vessels, and finally there's dense connective tissue. So what are the structures that is contained in the broad ligament? Firstly, there is the uterine tubes, the ovarian ligament, the round ligament of uterus, the uterine vessels and the ovarian vessels, the uterovaginal and ovarian nerve plexuses, the epophoron, the paraphoron, the lymph nodes and lymph vessels, and finally the dense connective tissue. After looking at the peritoneal ligaments, now let's look at the fibromuscular ligaments. There are three. First is the round ligament of uterus that you see right here. This is the bladder, this is the uterus, and here is the round ligament of uterus. And secondly, we have the transverse cervical ligament. So here in this diagram, you can see here is the cervix, here is the bladder and rectum. This is a superior view. And here is the transverse cervical ligament right here. And thirdly, there is the uterosacral ligaments right here. So these are the three fibromuscular ligaments: the round ligament of the uterus, the transverse cervical ligament, and the uterosacral ligament. Now concising the important points under the ligaments of the uterus, we have the peritoneal ligaments. These are peritoneal folds which do not provide any support to the uterus. The anterior ligament consists of utrovesical fold of peritoneum. The posterior ligament consists of rectovaginal fold forming the rectovaginal pouch of perit. Now the right and left broad ligaments that we studied in detail are the folds of peritoneum which attach the uterus to the lateral pelvic wall. When the bladder is full, the ligament has anterior and posterior surfaces and upper, lower, medial and lateral borders. The upper border is free. The ovary is attached to the posterior layer of the broad ligament through the mesovarium. The part of the broad ligament lying between the uterine tube and the ligament of ovary is called the mesosalpinx. The part below the ligament of ovary is called the mesometrium. The part of the broad ligament that stretches from the upper pole of the ovary and the infundibulum of the uterine tube to the lateral pelvic wall is called the suspensory ligament of the ovary or the infundibulopelvic ligament. The broad ligament contains the following structures. Firstly, the uterine tube, the round ligament of uterus, the ligament of ovary, the uterine vessels, ovarian vessels, the uterovaginal and ovarian nerve plexuses, the epophoron, parophoron, the lymph nodes and lymph vessels, and the dense connective tissue. The fibromuscular ligaments consist of the round ligaments of the uterus, the transverse cervical ligaments, and the uterosacral ligament. Now let's look at the arterial supply of the uterus. The uterus is supplied by two uterine arteries and partly by the ovarian artery. The uterine artery that you see right here is a branch of the anterior division of the internal iliac artery. Now looking at the venous drainage, the veins form a plexus along the lateral border of the uterus. The plexus drains through the uterine, ovarian and vaginal veins. So here is the uterine veins that you see right here, the vaginal veins and the ovarian veins. Through these veins, they drain into the internal iliac veins. Now concising the points under the arterial supply and venous drainage of the uterus. The arterial supply, the uterus is supplied by two uterine arteries and partly by the ovarian arteries. The uterine artery is a branch of the anterior division of the internal iliac artery. Looking at the venous drainage, veins form a plexus along the lateral border of the uterus. The plexus drains through the uterine, ovarian and vaginal veins into the internal iliac. Now let's look at the nerve supply of the uterus. The uterus is richly supplied by both sympathetic and parasympathetic nerves. The sympathetic nerves from T12, L1 segments of the spinal cord produce uterine contraction and vasoconstriction. The parasympathetic nerves produce uterine inhibition and vasodilation. Now let's look at the age and reproductive changes. In fetal life, the cervix is larger than the body of the uterus, which projects above the pelvic brim. At puberty, the uterus enlarges and descends into the adult position. During menstruation, the uterus is slightly enlarged and becomes more vascular, that is, there is more blood supply. During pregnancy, the uterus is enormously enlarged, mainly due to hypertrophy of the smooth muscle fibers and partly due to hyperplasia. In old age, uterus becomes more atrophic, that is, degeneration occurs, and smaller in size and denser in texture. Now let's learn about the supports of the uterus. Now the uterus is a mobile organ which undergoes extensive changes in size and shape during the reproductive period of life. It is supported and prevented from sagging down by a number of factors which are chiefly muscular and fibromuscular. So let's learn about the supports. So the supports of uterus are of two types, primary support and secondary supports. The primary supports are further divided into two, that is muscular or active supports and fibromuscular or mechanical supports. The secondary supports consist of broad ligaments, vesicouterine pouch and rectovaginal pouch. So first let's look at the muscular or active supports. So the muscular or active supports consist of the pelvic diaphragm, the perineal body and the distal urethral sphincter mechanism. So let's look at what is the pelvic diaphragm. The pelvic diaphragm is a muscular partition formed by the levator ani and coccygeal. So what are the muscles included in the levator ani? The puborectalis, the pubococcygeus muscle that you see right here and the iliococcygeus form the levator ani. So they form the pelvic diaphragm. And they support the pelvic organs and closes off the pelvic outlet, while allowing the passage for the rectum, the vagina and the urethra right here. Next, looking at the perineal body, it is a fibromuscular node to which 10 muscles are attached. It acts as an anchor for the pelvic diaphragm and thus maintains the integrity of the pelvic floor. Next, let's look at the fibromuscular supports or mechanical supports. They include 5 components. The first is the uterine axis. The second is the pubocervical ligaments that you see right here, the pubocervical ligaments. Third is the transverse cervical ligaments. Fourth is the uterosacral ligaments. And fifth is the round ligament of uterus. So firstly, looking at the uterine axis, the anteverted position of the uterus itself prevents the organ from sagging down through the vagina. Second, looking at the pubocervical ligaments right here. These ligaments connect the cervix to the posterior surface of the pubis. Then we have the transverse cervical ligament right here in yellow. They are fan-shaped condensations of the endopelvic fascia on each side of the cervix, above the levator ani muscle and around the uterine vessels. They form a hammock that supports the uterus. Then we have the uterosacral ligaments in violet. They connect the cervix to the periosteum of the sacrum behind. They keep the cervix braced backwards against the forward pull of the round ligaments. Finally, we have the round ligament of the uterus that you see right here. They are 2 fibromuscular bands which lie between the 2 layers of the broad ligament of the uterus and keeps the fundus that you see right here pulled forwards and maintains the angle of anteversion. So after having covered the primary supports, let's look at the secondary supports. They are formed by peritoneal ligaments and the 3 structures in it are the broad ligament, the vesicouterine pouch that you see right here, and finally the rectovaginal pouch or the retrouterine pouch that you see right here. Now concising the important points under the supports of the uterus is a mobile organ which undergoes extensive changes in size and shape during the reproductive period of life. It is supported and prevented from sagging down by a number of factors which are chiefly muscular and fibromuscular. The primary supports include muscular or active supports and fibromuscular or mechanical supports. The muscular or active supports include the pelvic diaphragm, the perineal body and the distal urethral sphincter mechanism. The fibromuscular or mechanical supports include the uterine axis, pubocervical ligaments, transverse cervical ligaments of Macondot, the uterosacral ligaments and the round ligaments of uterus. The secondary supports, they are formed by peritoneal ligaments. They include the broad ligaments, the vesicouterine pouch, the rectovaginal or retrouterine pouch. Now looking at each of its functions, the pelvic diaphragm, that is of the muscular or active supports, the pelvic diaphragm supports the pelvic viscera and resists any rise in the intra-abdominal pressure. The perennial body is a fibromuscular node to which 10 muscles are attached. It acts as an anchor for the pelvic diaphragm and thus maintains the integrity of the pelvic floor. The uterine axis, that is the anteverted position of the uterus itself, prevents the organ from sagging down through the vagina. The pubocervical ligaments. These ligaments connect the cervix to the posterior surface of the pubis. The transverse cervical ligaments are fan-shaped condensations of the endopelvic fascia on each side of the cervix, above the levator ani and around the uterine vessels. They form a hammock that supports the uterus. Now the uterosacral ligaments. They connect the cervix to the periosteum of the sacrum. They keep the cervix braced backwards against the forward pull of the round ligaments. And finally the round ligament of uterus. They are 2 fibromuscular flat bands which lie between the 2 layers of the broad ligament and keeps the fundus pulled forwards, maintains the angle of anteversion. I hope you found this video helpful. To get the notes of uterus as well as other topics of anatomy, physiology, biomechanics, psychology and pathology, visit my Instagram page or email me in the link given in the description below. If you found this video helpful, do like, share and subscribe to my channel. Thank you for watching.